This is, okay, class. We're starting all over. Unfortunately, I did not realize my audio was not on, but nevertheless, we're starting in Chapter 6, Computers and Health Information Management. I will post this lecture on within our announcements for your perusal next time you are able to view the video in its entirety. I won't be able to lecture through the entire PowerPoint because it's over 40 some odd slides. So I'm going to do the best I can in the next 20 minutes or so to get through the meat of this presentation. Our learning objectives are to identify the information systems needed to support efficient operations in the Health Information Management Department. Additionally, to differentiate between the various software products used in HIM, and also to improve the quality of data within the HIM system. Health informatics, and we've briefly talked about health informatics, and it's such a viable topic, which is why I loaded the presentation last week for you from healthit.gov. It gives you a very detailed background on health informatics and, of course, how it's applied in our profession and throughout the continuum of healthcare. So health informatics itself is defined as a scientific discipline concerned with cognitive information processing and communication tasks of healthcare practice, education, and research, including information science and technology to support these tasks. And so there's not an exclusive or, if we will, informatics in and of itself can be limitless, as you can see from this definition. Computers and health information management, and there are many applications within HIM that are interfaced with the HIS system, Hospital Information System. Number one that you should be familiar with if you work in HIM, or of course since you're pursuing your baccalaureate degree in HIM, is the release of information and also any disclosure management systems. This can be a database that also actually works in terms of release of information, software for doc management, if you will, is what they call it. And it also assists in accounting of disclosures. Encoder and grouper systems, of course, anything that's going to assist in coding. This does include CAC systems, computer assisted coding systems, cancer and other registry systems, chart locator systems, and these are typically barcode tracking systems, and any birth certificate registration type systems. Additional computers in HIM include chart deficiency tracking systems and/or software, transcription systems and/or software, healthcare quality indicator systems, dictation systems, including voice recognition systems, computer-assisted coding, which they had that on the actual coding. They did not have it on the coding screen. I assumed that they would, but they listed it here. And then CDI systems, or clinical documentation improvement systems. Release of information and disclosure management systems that you should be familiar with. They manage the process for protected health information to receive and process the information. So information coming in, received, and information disclosed that is sent out, it can account for and document the date it was received, where it's at in terms of processing, and then any letters circulated in the process of actually, in the actual facilitation of the disclosure. For instance, if there's a problem with the authorization form, it will document to the requester that the authorization form is not authentic by signature, or that pertinent information relevant to the disclosure is missing. And of course, that information will need to be completed before the actual disclosure can be made. And so they track the disclosures made throughout the healthcare facility and any reporting in terms of accounting of disclosures. Release of information staff can use the system to check on the status of requests, which is very vital, in particular when you're managing hundreds and thousands of requests for release of information. So it can readily, at the drop of a dime, give you information based on a query as to where the disclosure or request for disclosure, the authorization, if it's been completed, if it's in processing, and the anticipated date of disclosure to the recipient. Can give you a status of the request, and it can update request as well. Additionally, doc management systems, of course, they not only process authorization forms, they process subpoenas, also information relevant to this disclosure, for instance, power of attorney or healthcare proxy. All of that information is retained in that doc management system. Other release of information data elements, of course, and this is something you all are all familiar with in terms of identifiers: patient's name, medical record number, patient type, whether it was inpatient, outpatient, ambulatory, etc., the date the request was received, and who is the person or entity making the actual request. The name of the requester, contact person of the requester, the address, and then the type of request being made, whether it's from a patient themselves, attorney, patient care, for continuity of care and or insurance. Then, of course, it's assigned to an individual to complete the task. The doc management system will notate the date of action, who completed the request, and when the information was transmitted. Now, of course, in terms of transmittal, it's not always necessarily such that it will be transmitted via mail. It can be transmitted via hard disk, a compact disk, through encryption, or it can be transmitted electronically via email with the appropriate passwords and authentication systems. Typically, when that's done, there is a dual process of authentication for release of information. Then additionally, it will include any charges, and these charges are pretty much submitted by the state. Your state determines the fees that can be collected for release of information, the amount paid, what's due, and any other comments relative to the request. Requests that have not been processed are also facilitated through the system in terms of tracking. Requests that have been processed, requests that have not been processed, and of course those that have been processed. Turnaround times can be collected, which is very pertinent information in terms of productivity standards being met, revenue collected, and accounts receivable. How much are we receiving in terms of revenue for release of information? Release of information has become a very lucrative practice in some facilities. Some of the large facilities, they actually recoup hundreds of thousands of dollars, believe it or not, in release of information. So depending upon the quantity and volume of requests that are made at any given facility, it can be a very well compensated area that more than less covers the cost of FTEs, and then also becoming a revenue generator at the same time. Productivity also by individual staff members, as I alluded to. Overall productivity, a list of frequent requesters, and then multiple customized letters can be created in a doc management ROI system. I'm not sure if you have observed such a system, but there are many private vendors that have these types of systems. And you may want to check, I don't know what you have in your particular state, but there are many in the state of Illinois that compete for large facilities because of again, the revenue that can be generated from release of information. But they can also generate customized letters based on the need of the facility. They can submit reminder letters for outstanding balances, and then they can request copies of health records to be paid prior to release. Some other customized letters include to provide the cover letter being sent out from the facility, and then notify the requester that the authorization is invalid, and then notify requester that an authorization is needed and that there will be a delay in the processing. And so most of these letters are standard for the institution, but you can just simply type the template into your doc management system and it will generate any letter that you deem necessary for processing requests. Another letter, customization letter, is to notify the requester that the health records will be released as soon as the facility has received prepayment for copies. And why prepayment? Well, if you have a large volume record, pages 200 to 300 pages or more, the bill can be up towards $1,000. And I imagine you might say, how could that be? In the Veterans Health Administration, we had very, very large records, and probably more so due to the fact that the Veterans Health Administration is not under DRGs as we know them in private sector. They are under a DRG system, but it's under what they call VERA payment. And under VERA payment, it's not so based on length of stay as you would find in an acute care setting. Therefore, you will typically find a 30, 40, 50, 60-day stay in a veteran's hospital many times. And that copy of that medical record can be up towards $1,000. I've seen it so many times. All right, you can also generate reminder invoices that have not been paid in a timely manner. In terms of system functionality, you can monitor the efficiency in terms of release of information, in terms of multitude of management reports. Again, it talked about turnaround times, we've talked about already, accounts receivable, etc. Now, another software that you should be familiar with, and you probably already are, is an encoder grouper. And based on submissions that I've seen from students in the past, most students are quite savvy in terms of being able to identify encoder grouper software. The prominent software packages are what? 3M, they're Quadramed, Optum, which is now Optum, used to be Quadramed. And then there's another system, Adobe. Yeah, there's a third system that's a recent competitor. So an encoder software is used by coders to assist them in selecting. They needed to add that word, the appropriate code, because it can't do it by in and of itself. It needs it needs analytical ability based on a human being. The technology is present, but we need that analytical ability based on that trained coder to help identify or to make the final decision in terms of what the appropriate code is. The grouper is the software that uses specific data elements to assign the diagnostic and procedural codes entered into the encoder. The appropriate Medicare severity diagnosis related group code, MSDRG, or other DRG. The rules-based encoder, it requires a coder to type in the name of or portion of the name of the diagnosis or procedure, and then entry into the encoder, which generates a list of suggestions. That's why I said it can assist, because it's going to assist you by generating a list of suggestions, and what you, the coder, utilizing your analytical abilities, will decide what is the more specific code based on specificity and precision. What we call the encoder for automated cookbook encoder. It lists diagnoses and procedures in alphabetic order, much like an alphabetic index. And of course, this is based on what? ICD-10 and then CPT. Your most common groupers are the MSDRG grouper, and this is not the private name of the vendor, but these are the types only. And then of course, for your ambulatory patient classification systems, APC. Other insurers include Medicaid groupers, which have been developed in determining payment for healthcare facilities. Coding quality and MSDRG assignment are not ensured using an encoder. Code selected is only as good as the data entered into the information system, thus only as good as the analytical ability of the coder. One of the biggest advantages in the use of the encoder grouper is the ability to prompt you for selections. All right, these are the various data elements that are utilized in an encoder grouper. As you can see, your admitting diagnosis, your principal diagnosis, your secondary diagnoses, your principal procedure, secondary procedure, the age of the patient, and the date of birth. And as you will note under principal diagnosis, principal meaning inpatient typically in this terminology. When you use the term primary, typically that's referring to an encounter that is outpatient or ambulatory. But when you see the terminology principal diagnosis, that implies inpatient or acute care setting. All right, the other data elements are discharge disposition, gender, patient name, healthcare record, account number. Now, discharge disposition, it should be noted that that is a vital data element that must be recorded. Reason being, if your discharge disposition is not recorded accurately, it can affect reimbursement to the facility. A case in point would be a patient who's discharged to a skilled nursing facility from an acute care setting. And so that level of service is now downgraded from acuity level of acute care to skilled nursing, which is a lower level of care in terms of acuity. Therefore, the compensation and or payment or reimbursement to the acute care facility is less than it would be if it was just solely an inpatient who went home from the acute care stay. Since they are now transferring to another level of care, again, the payment will be less. Had it just been solely that level of care, the payment would be more. All right, so now that discharge disposition plays a vital role in determining reimbursement based on that DRG. Okay, I'm not going to go further into encoder grouper systems, etc. What I'm going to do is to load this balance of this presentation on to our announcements so that you can view this in your leisure time. Again, I believe it's over 40 some odd slides. So please, at your leisure, please review the balance of these slides and let me know if there are any questions or comments that you might have in reference to this presentation, or if you have any questions. Thank you so much. Enjoy your evening. Goodbye.